Halkitis. I am the Dean of the School of Public Health at Rutgers University. For over 2 decades, my work has focused on infectious diseases, specifically HIV, and the intersection of infectious diseases with social and structural and behavioral determinants, and the syndemic or the comorbidity that often exists with the transmission of infectious disease like HIV with drug abuse and mental health. I've primarily looked at these connections, and I've developed interventions in the LGBTQ plus population, but not exclusively. And so that's been the focus of my work, really community engaged, activist led, high level scholarship, trying to eradicate these disparities in our society. There are structural inequities that drive these disparities. So, and people don't wake up one morning deciding that they should have a drug addiction, or they should acquire HIV, or they should get COVID, or they should be obese, or they should smoke cigarettes, right? These are situations and health conditions that emerge in people's lives. So we have focused too much on the individual level intervention, like how do we get people to stop smoking? How do we get people to stop drinking? How do we prevent people to stop from acquiring HIV? And my argument is that those kind of behavioral interventions are good, but insufficient. And that what we really need to do is think about what are the conditions that fuel these behaviors in people? Like, why is it that we see such high levels of psychopathology in LGBTQ people? Why do we see such high levels of drug use? And my argument is that for the LGBTQ population and other populations which are discriminated and marginalized, there are these social stressors, discrimination, homophobia, racism, misogyny, that create psychosocial burdens in people's lives, that create stressors which engender risk. And as a result, they place themselves at risk for potential problems. And so I think that you want to affect a change, you need to affect a change on the social level, the structural level, the behavioral level, and the biological level, all in combination.